And now I'd like to bring up Brittany Combs, our first speaker, who's a registered nurse who currently serves as the Director of Public Health Nursing with Scott County Health Department. Since she has worked in public health for the past 9 years, she has assisted with an H1N1 epidemic, a local tornado disaster, and an HIV outbreak. Thank you so much, Brittany. Welcome.
Good morning. Okay, so I'm going to talk about the before and the after as opposed to the public health nurse. So before the outbreak, my job duties were communicable diseases, immunizations. I did an OASIS, which is an older adult clinic, smoking cessation classes, tuberculosis tests and treatments, and linking people to services, which is really important later on in the slides. And I love this picture of the old public health nurse on her horse. One of these days, I'm going to do that. Needle exchange on a horse. That won't cause anybody to have any issues with it. When I was a kid, little sidebar, when I was a kid, I loved Little House on the Prairie and Doc Baker coming to the house in his little horse and buggy, or the Waltons where the nurse got on the horse and went out into the mountains and took care of the people. So that's what I always wanted to be when I grew up. And then I've talked to Jake about this several times. Right before the HIV outbreak, I was seriously thinking about doing mission work overseas. I was praying about it a lot, really thought that was something that I really, really wanted to do. And then we had an HIV outbreak, so there's no time for that. The community before had huge rates of hepatitis C. But I wasn't hugely concerned because there were huge rates of hepatitis C throughout the state. So it wasn't just us at that point, it wasn't just us. We had tons of endocarditis, very, very young people dying from heart disease, which is really sad to see. Abscesses, almost everybody had abscesses. Our hospital was inundated with abscesses, our ER. Overdoses, tons and tons of young people dying from overdoses. Limited testing sites for HIV and STDs, and by limited, I mean pretty much non-existent. Very few people on insurance. Limited addiction services, limited access to services in period, and then high number of DCS cases related to parents who inject drugs. And then, bam, this happens. This is the HIV cluster map. The red dots are people that are HIV infected. The blue dots are uninfected. The lines are what really, really, really are shocking. The black lines that connect the red dots are people that shared needles with each other, that were injection drug users. The red lines were people that had sex and injected drugs with other people, and then the blue lines are just the sexual, which you can hardly see because it's all black lines. That was the most shocking part when they first showed us this map, was that look at all the needle sharing that's going on, and that's how this disease was spreading. So HIV hits home. We currently have 231 cases of HIV in Scott County, and Thomas Frieden said that we had a higher incidence of HIV in Austin than in any country in sub-Saharan Africa. So a big bright light was shown on Scott County, and there was a lot more than this, but this is just some of them that came to shine the light on our county and what was going on. Scope of response. This, I love this slide. Someone at the state put this together, and I steal it and I use it all the time. I love this because the needle exchange gets so much hype and so much publicity, but as you can see, the scope of response, the needle exchange is one tiny little piece of everything. So you have to have community education constantly. You have to have the epidemiology. You have to have the one-stop shop for people to get other services. You have to have addiction treatment services. You have to have medical care for people. All of this was part of the response, not just the needle exchange. So we had lots and lots of challenges. Very few insured, limited access to services. So the one-stop shop really helps with a lot of that. We had no HIV or Hep C care in Scott County, which we now have 2, Foundations Family Medicine, and then with the IU infectious disease doctors come down twice a month to treat people for HIV and Hep C. Limited HIV awareness. This is constant. We are constantly educating people. especially with HIV, because when you say the words HIV, people's brains just shut down, and all common sense goes out. And you have to constantly be re-educating them on what HIV is and how it's spread. Don't freak out. Let's walk through this, and we'll learn about it again. And so we're constantly doing different campaigns and educating people on HIV in particular. Syringe exchange was illegal, so obviously some laws had to be changed to where we could have the needle exchange. There were limited addiction services. There's still not enough, but we have more than we had before. And then the focus was obviously on HIV infection, but we have a huge population of Hep C individuals that really, really needed to be taken care of, and we're still working for that. So here I am doing my mission work, but right in my own backyard. So there's a lot going on with the needle exchange, and we learned really, really quickly that people won't come to you, you got to go to them. So we loaded up the van, and there we went. And so this is me doing some of those things right there in my own backyard. So I don't have that desire to do the mission work anymore because I'm doing it every day. This is the intervention of the needle exchange. And I love this slide too because first it shows the mobile outreach and then also shows the fixed site. You have to have both really to make it work. But what we do is we not only give them clean supplies for a week, we also dispose of the used needles, do health education on safe injection, harm reduction, do HIV counseling and testing, HIV prevention and condoms, which we never had available before the outbreak, which is sad. With the highest rate of STDs and the highest rate of teenage pregnancy, we had no condoms available. So we have them everywhere now. And then we can refer them. So we refer them to PrEP, antiretroviral therapy, mental health services, and substance abuse treatment. The thing that we didn't understand was, before the outbreak, I had no idea how to reach that population of people. There was no way for me to get to them. But the needle exchange is the first line that a lot of these people get for these other services. So we have a Get Healthy Scott County Coalition, and we also have a CEASE Coalition, which is our drug abuse coalition. And both of these were founded before the outbreak, but they didn't have a lot of attendance and weren't really had focus. So after the outbreak, all resources of both of these coalitions obviously are focused on substance abuse disorder and then all the issues that are related to that. This is the Get Healthy Scott County Coalition, and we have lots of different areas that we kind of narrowed it down to that need to be focused on, and now we have working groups in each of these areas. So programming, education, support for families and the community. The second one is multiple paths for treatment and recovery. The third is support groups. There's youth, transportation, housing, and job training. Because we all know in order for people to quit and to stay quit, they have to have all of these services in place. They have to have a place to live, a clean, sober place to live. They have to have a job. They have to have all of these things that are related to recovery. This is one of the meetings that we had for Get Healthy. We have a lot of people at the table now that were never at the table before. This is the deputy sheriff, our prosecutor, and the CEO of our hospital all sitting at a table having a discussion. That never would have happened before the outbreak. But everybody's coming to the table now, and things are actually getting done. CEASE of Scott County is our drug coalition. They have acquired a drug-free communities grant in the late 2016, and it's funded through ONDCP and SAMHSA. And they have used the strategic prevention framework model to pinpoint root causes for youth substance misuse. And one of the things they've mainly identified are ACEs, which if you haven't heard about them, I'm sure you're gonna hear about them a lot. ACEs are adverse childhood experiences. So they realize that stressful or traumatic events cause children to go into substance abuse. That can be abuse, neglect, domestic violence, which is what I was thinking of, but it can also be things like growing up a family with people that abuse substances. So they're more likely to become substance abusers themselves in the future. This is a work group at CEASE. There's a lot of different people at that table too, so a lot of things are getting done there. Collaborative community efforts for CEASE training, education, and lots of events, community awareness campaigns, health services, treatment services, law enforcement, youth-focused initiative, and then obviously the recovery community. This is one of the prayer walks that we had. We've had multiple. This is Together for Scott County, T4SC, one of the many prayer walks we had. And then this is another picture of the T4SC from darkness to deliverance. So they go through the town and are trying to promote us all working together to stop this issue. This is the Fed Up rally to try to stop the opioid epidemic nationwide. And these are our beautiful people in recovery that participated in the Fed Up rally. CEASE has done lots of different activities, including inspect training for our providers, Overdose Lifeline. They had Overdose Lifeline come in and teach about substance use disorder, and then naloxone. They've done several naloxone trainings. Our hospitals had HIV workshops, education workshops, and it's just like HIV 101. So if anybody wants to know about HIV, they can take this course and learn HIV 101. And then all students from 3rd through 12th grade get evidence-based prevention education at school, which was never done before the outbreak. It was a stick your head in the sand kind of situation, and if we don't talk about it, it's not going to happen, but obviously it was happening for multiple generations. So several campaigns have been done with the youth, particularly. This is the Stand With Us. What's your side effect? So what's your side effect as a youth? How are you going to affect your community? And so these are several of the students that posed with the banner. That's the Scottsburg High School. And so there's lots and lots of kids. This is the hospital staff that was a part of the Stand With Us. And this is the What's Your Side Effect? It's a positive social norms campaign that was done in Scott County. And these kids actually did a video, and it is hilarious. They are so fun. And they are really going to make a difference in our community for years to come. These are the Austin students that were doing the speaking up about protecting their futures. Health services. So we now have the one-stop shop in Austin, and that includes HIV care. LifeSpring has a federally qualified health clinic now. We have a federally qualified health clinic in Scott County. This is huge because we never had anywhere to refer people before. Seymour was the closest, which is about 25 miles. People won't drive 5 miles to the health department from Austin to Scottsburg, so they're not going to go 25 miles to go to the doctor. It just didn't happen. So now we have an FQHC that we can refer people to for their medical care. We also, at the bottom, have insurance navigators. We love these girls because I don't do insurance. I don't like insurance. And close your ears, Dr. Waffle. I don't want to know about it. But that's okay, because I have these girls that know all about it, and I refer people to them. And we actually just call them the insurance girls. We always tell people, just go to the insurance girls. They'll fix it for you. So they have helped so many people in our community get insurance and keep insurance, because we know it's not about just applying for it. It's all the things afterwards, and they work really, really hard to make sure that people get everything in that they need to get in to make sure they're approved and on their insurance. So they're absolutely amazing. We never had that before. This is huge also. Treatment services have expanded. We need more. Obviously, we need more. We don't have enough. But they've expanded tremendously. So LifeSpring and Centerstone have both opened up offices right in Austin. Centerstone expanded to Scottsburg. LifeSpring began recovery works in our jail. So we have a recovery work system right in our jail. And this picture is the opening of the Centerstone Recovery Center for Women. So Scott County has their very own women's recovery center. If you would have told me that 3 years ago, I would have said you are absolutely insane. But we have that now, and it's helping a lot of women with their treatment. Law enforcement activities. Party patrols, they've increased surveillance in parks. They do DEA drug take-back days, which they just had one last weekend. And now we have prescription drug boxes at both of our police stations, one in Austin, one in Scottsburg. If anybody has medications they want to get rid of, they drop them in the box and they don't have to worry about it. Youth initiative. Our youth has actually created their own coalition. It's called Empower. And These youth are going to change the trajectory of our whole community for years to come. They have so much, they're so smart and so empowered, that's where they came up with the name, to change the way that our community is. This is our recovery community, so don't make me cry, girls, because this is the good part. These people in recovery are going to change, they change the way that the people that are living now with substance abuse live. Our recovery support groups have gone from 4 in 2015 to 18 in 2018. And let me tell you, the 4 that were here in 2015 were a joke. I thought I could refer people to an NA meeting and they would get taken care of. Well, when we started doing the mobile unit, we had a lot of people asking us, where can I go? I need help, I want help. Go to this NA meeting. They're like, oh, I can't go there. Well, why not? Well, that's just where people go to exchange drugs. And I'm like, what? And then somebody else told me, oh, well, that's go with the guy that runs that one is just soliciting women for sex. And I'm like, seriously? So I couldn't refer to NA groups, but we pushed them out and real NA groups came in and they are changing lives every single day. We have a group every night of the week, and that is tremendous for a lot of people. We have a Recovery is Beautiful wall. It's a wall of people in recovery with their stories, and we have this place in several places throughout the community. People can go and read these stories, and they can feel empowered that they can change their lives too and be in recovery. This is our peer recovery coach class. We now have peer recovery coaches in Scott County. This is tremendous. We're working really hard to try to get them in places where they really need to be, like the ER. So when someone overdoses and they go to the ER, this peer recovery coach has been through this, they know what they're going through, and they can help them get into treatment. The recovery community also did their very first mural on the wall of H2O Church in Austin. So they painted this beautiful mural, and there's all those yahoos now. They're crazy, but they did an amazing job. It's absolutely beautiful. And they are totally knocking down the walls of addiction. And this in the center is Lori Crosdale. She is our CEASE coordinator for our drug coalition. On the right is Tiffany. She is our HIV tester. On the left is Kelly. She is our HIV, you'll have to help me, HIV Outreach Prevention Coordinator. I got it. She has a big long title, but these girls are in recovery, and they work for the health department now, and they change lives every single day. I see it. It's amazing. So when we first started the needle exchange, I literally had to lock myself in a room with someone from the state and someone from CDC, and we had to design this program. And the girl from the CDC, Dita, she told me, she said, you're going to have people in recovery that are going to be working for you someday. And I was so naive. I thought, there is no way. I will never be able to trust them. I don't know them. And now we have people in recovery, and I do not know what I would do without them. They are amazing. And it's amazing for our people because you can see it. I can stand there, and I can watch them talk to someone, and you can see in their head, I mean, you can see it change. Like they think, I can do this. If they're doing this, I can do this. We see it all the time, and it's absolutely amazing. So I don't know what I'd do without people in recovery working for us now. This slide just shows the referrals that we do. So like when people come into the One Stop or the needle exchange, we always look at the referrals. And so I thought this was good because the number 2 is substance abuse treatment and substance abuse recovery groups. Those are the 2 that we're referring to the most because those are the people are asking for those the most. So evidence of recovery. 700% increase in participation in recovery support groups. That is insane. 700%. We have gone from 17 overdoses in 2016 to 6 in 2017, and I'm for certain that's because of the Narcan that we're giving out. From 247 chronic hep C cases to 106. There's only 12 new cases of HIV in 2017. And the CDC has told us with the amount of HIV that we have in our population that we can expect 26 new cases every year. So we've cut that in half. Skin abscesses related to injection drug use in the hospital has massively decreased. And I can tell you it's decreased in the needle exchange too. When we first opened, every single person had an abscess of some sort, which is, I don't know, I like pus, I'm a nurse, so it's fine by me, but I don't want them to have those infections. I know, that's gross, but I don't want them to have those infections, right? And it caused a lot of other issues, and a lot of them got MRSA along with it, and then they would have scarring, and then there's like all these things with it. So even though I like pus, I don't get to see a lot of abscesses anymore. And then, more importantly, the number of endocarditis cases have drastically decreased. I think I've only heard of one in the last year, which is tremendous because we were having a lot of those. Social and economic outcomes, we've had redevelopment of devastated areas, employment opportunities for those in recovery, and the news headlines have been recovering more of a positive message. And then for the first time in 9 years, Scott County is not the worst. We were 92 out of 92 in the health outcomes, and now we moved up to 91. Aren't we good? I'll take it, I don't care. And this is gonna get better because the data is several years old. So we know it's gonna get better because the number one thing, like over 50%, is the years of life lost. So people dying really young if they've lost those years of life. And we know we're saving a lot of lives and letting people live a lot longer. So we know those numbers are only gonna get better. So recovery is cool. When you go from not even understanding recovery and not having anybody in your community in recovery, and to the point where you tell someone, and it's sad that I had to tell people, if you want to quit, you literally have to leave this county because you can't stay here, to saying that the end thing now is recovery is cool. And so we've heard that multiple times, people saying recovery is the cool thing now in Scott County, and so we definitely want to continue that for sure. Here's our contact info, and so to close, I just want to say, like, we're not where we need to be. Obviously, we have a lot more work to do. But as you can see, we've come really, really far in 3 years. And the one thing that we have that we did not have before is a little bit of hope. So if you can give people a little bit of hope, then you can change a lot for the future. And that's it.